One.
Hi, my name's Samantha. I'm going to be your student nurse today. Can you tell me your name and date of birth? All right, and do you have any allergies that I should be aware of, such to latex or adhesives? All right, I'm just going to check your wristband here real quick. So today what we're going to be doing is a dressing change on your central line, just so we can make sure we get a new dressing on it for the week, and then we're looking for any signs of swelling or infection, okay? Does that sound okay? Do you have any concerns or contraindications to the procedure today? All right. I would go ahead and raise the bed at this point to a good working height, but it's already set at it, so that's good. So now I'm going to go ahead and put a mask on myself, and then I'm going to educate the patient that I'm going to have them put a mask on and turn their head to the left. This is just standard precautions because we're going to be exposing that catheter site. All right, once I make sure that they're comfortable and their head is turned, I'm going to go ahead and just feel around the insertion site for any warmth, look for redness, swelling, palpate for any sub-Q emphysema, which I don't feel any. All right, and then I'm gonna go ahead and start removing the dressing now. So I'm gonna make sure to stabilize the central line at the chest wall insertion spot and pull from the edges first. And as I get closer to that insertion site, I will begin pulling up once all of my edges of the transparent dressing are disconnected. I'm gonna pull up, that way I don't dislodge the catheter from the chest wall. At this point, I'm also looking to see the measurement so I can confirm with the recent documentation that it has not dislodged at all and it's in the same placement. All right, and now we're gonna get to the sterile portion of this. Raise this up a little bit. Make sure my patient's still comfortable, they're okay. Fix my mask. Hand hygiene. Now I'm going to open my sterile pack. Without touching anything. I'm going to open it away from me. I already have a mask on, so this can go in the trash. I'm gonna pull out my sterile gloves here. I'm gonna open them up. I would open away, then I would open apart and cover myself. Make sure I'm not touching anything. Under the cuff. Use my gloved hand. Grab under this cuff. Watching my thumb here. And then I can adjust them now that they're both on. Then I'm going to grab out my sterile field, only touching the 1-inch border. Keeping my gloved hands up. And then I can lay the shiny side down. Now I can position it from the middle how I want it. I'm gonna toss things that I don't need. I don't need those. I'm gonna use the chlorhexidine swab, so I don't need my alcohol swab. Put my label on my field. Open up my alcohol swabs. Place those on my field where they're easy to grab. Okay. Grab my antimicrobial patch, tape if I need it, push that off to the side. So now what I'm going to do is I'm going to stabilize with one hand the catheter in place. That way it doesn't dislodge while I'm cleaning around it, and I'm going to clean for a total of 30 seconds. There's 3 swabs, so I'll do 10 seconds a piece from inner to out. So I'm going to stabilize this with my right hand. Grab the swabs out with my left. So I'm going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Throw that over there. Grab my next swab. Making sure that it doesn't come off of the table. Grab my sterile field. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And now my last one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and now I can release that. Let it air dry. I'm going to use my left hand that's still sterile to grab my antimicrobial patch. Place that over where the catheter is inserted to the chest wall itself. And then I am going to grab my transparent dressing. Peel off this part. Stabilize the catheter. I want to make sure that the cap of the catheter is left exposed, so the split at the bottom is going to go where my catheter is inserted. Lay that down, then I can use my right hand to push down, follow it up. Make sure it's secured. This little tape can come off. And now that it's covered, it's no longer a sterile procedure because the insertion site is not exposed, so I can keep that sticky on the finger. I'm gonna go ahead and begin to pull this off. Again, making sure that the dressing is all the way adhered to the skin, all the way around. Get my label off of here so I don't throw it away. And then I am going to place my label over the dressing. I'm going to grab my pen or marker. I'm going to put my initials, the date, and then the time in which this dressing was changed. I'm going to go ahead and start throwing some stuff away. I'm going to remove my gloves. I'm going to do hand hygiene. I'm going to educate my patient. You can turn your head back. You can remove your mask, or if they needed help, I could go ahead and remove it for them. I'm going to remove my own. Get this stuff out of the way. And then I would make sure that my patient is comfortable and they feel okay, they're pleased with the procedure. I would then lower the bed, which we've been having difficulties with it won't turn on. So I'd lower it to the lowest position, have no more than 2 bed rails up unless indicated otherwise in the orders. And then I would make sure to document that I did the dressing change, The date and time will automatically go in when I document, and that there was no signs of inflammation, swelling, or subacute emphysema.